Otitis media, commonly known as a middle ear infection, is a condition that primarily affects the middle ear, which is the space behind the eardrum. It can be caused by various factors and is characterized by specific signs and symptoms. What is middle ear? The middle ear has three small bones. The eardrum keeps the bones away from the outer ear. A narrow path called the Eustachian tube joins the middle ear to the back of the nose and upper part of the throat. Causes: infections. The most common cause of otitis media is an infection, often bacterial or viral, that spreads from the upper respiratory tract to the middle ear. Eustachian tube dysfunction. Problems with the Eustachian tube, which helps regulate ear pressure, can lead to fluid buildup in the middle ear, increasing the risk of infection. Adenoids swelling. Adenoids are two small pads of tissues high in the back of the nose. Adenoids are near the opening of the Eustachian tubes. Swelling of the adenoids may block the tubes. This can lead to middle ear infection. Swelling and irritation of adenoids is more likely to play a role in ear infections in children because children have relatively larger adenoids compared to adults. Allergies. Allergic reactions can cause inflammation in the Eustachian tube, hindering proper drainage and increasing susceptibility to infections. Infants' feeding position. Babies who drink from a bottle, especially while lying down, tend to have more ear infections than babies who are breastfed. Cleft palate. Differences in the bone structure and muscles in children who have cleft palates may make it more difficult for the Eustachian tube to drain. Environmental factors. Exposure to tobacco smoke or high levels of air pollution may increase the risk, especially in children. Sign and symptoms. Ear pain. This is one of the most common and noticeable symptoms. It can range from mild discomfort to severe, sharp pain. Hearing loss. Mild hearing loss is common with an ear infection, but it usually gets better after the infection clears. Ear infections that happen again and again or fluid in the middle ear may lead to more significant hearing loss. If there is some permanent damage to the eardrum or other middle ear structures, permanent hearing loss may occur. Fever. Infections often lead to high fever, especially in children. Irritability. Young children with otitis media may become fussy or have trouble sleeping due to ear pain. Fluid drainage. In some cases, pus or fluid may drain from the affected ear. Balance problems. Otitis media can affect balance, leading to dizziness or problems with equilibrium. Treatment. Warm compresses. A warm compress can help reduce ear pain. A soft piece of cloth dipped in warm water and then hold it against the infected ear for up to 20 minutes. If the compress seems to help with the pain, repeat the compress throughout the day. Rest. Sleeping and resting strengthens the immune system and helps your body fight against infections and other sickness. But it's best not to sleep on your infected ear. If you are an adult with a middle ear infection, elevating the affected ear makes it easier for the infection to drain out. So sleep on your other side or tuck a few extra pillows under your head if sleeping on your back. Gravity. Gravity can be best for this issue. By lying the right way, gravity pulls the fluid down. It smartly guides the fluid out of the middle ear and treats the infection. Saltwater gargle. Salt water is known as an effective way to reduce inflammation, and salt water could help an ear infections as well. Add 1 teaspoon salt to 1 cup of warm water and gargle it for a minute. If your ear infection is related to a swollen throat, this can help reduce your symptoms. Ginger tea. Ginger tea is known for its anti-inflammatory properties. It may also reduce pain if drank a bit warm.